Welcome, esteemed colleagues, to our discussion on differential diagnosis and imaging for the neuromusculoskeletal system. Today, we will delve into the crucial role of diagnostic testing in the pursuit of accurate diagnoses and effective treatment plans. As healthcare professionals, we understand that the derivation of a diagnosis relies heavily on the patient's history, working diagnosis, physical examination, and a thorough reassessment of the working diagnosis. However, in some cases, further testing is required to solidify our findings or determine the extent of the condition. When the history, physical examination, and initial diagnosis warrant further investigation, we have a range of testing modalities at our disposal. These may include imaging studies, electrodiagnostic studies, laboratory tests, and other specialized examinations. The goal of these tests is to either confirm or refute our initial diagnosis, or to shed light on the severity and extent of the condition. One of the most powerful tools in our diagnostic arsenal is imaging. Depending on the suspected pathology, we may order various types of imaging studies, including MRI, CT scans, X-rays, musculoskeletal ultrasound, DEXA scans, and bone scans. MRI scans are particularly valuable for evaluating soft tissue pathologies and medullary bone abnormalities. We order MRI scans to visualize disc pathologies, spinal cord abnormalities, tendinopathies or tendon tears, muscle tears, ligament and capsular tears, occult fractures, stress fractures, bone stress responses, and impaction fractures. When ordering an MRI, it is essential to specify the type of scan required based on the suspected diagnosis. We may request an MRI without contrast, an MRI with contrast or gadolinium, an MR arthrogram for intra-articular injections, an MR angiogram for vascular imaging, or an MR neurogram for nerve evaluation. The diagnosis on the order form must be specific and appropriate to ensure the correct imaging protocol is followed. It is crucial to dispel the antiquated notion that MRI is solely for soft tissue visualization, while CT scans are for bone imaging. In reality, MRI is the tool of choice for evaluating medullary bone pathologies. This advanced technology allows us to obtain detailed images of the bone marrow and internal bone structures. An MRI scanner is a massive electromagnet weighing approximately 20,000 pounds. It creates a powerful, unified magnetic field measured in Tesla units. High-field strength scanners typically operate at 1.5 to 3.0 Tesla, while low-field strength scanners range from 0.3 to 1.0 Tesla. During an MRI scan, the patient is positioned in the center of the scanner bore, which can be a confined space. It is essential to prepare patients for this experience, as some may experience claustrophobia. Advising patients to keep their eyes closed during the scan can help alleviate any discomfort or anxiety. Historically, open MRI scanners were designed to provide a more open environment for claustrophobic patients. However, these scanners often sacrificed image quality due to their weaker magnetic field strengths. Recently, 1.5 Tesla open scanners have become available, offering a balance between patient comfort and image quality. It is crucial to inquire about the field strength when ordering scans, as this information is not always provided on the report. Higher field strength scanners generally produce superior image quality but come at a higher cost. If a radiologist has access to a high field strength scanner, they will typically note this on the report. If the field strength is not mentioned, it is advisable to contact the imaging facility and inquire about the specifications of their MRI scanners. For musculoskeletal pathologies, both 1.5 Tesla and 3.0 Tesla scanners are considered acceptable. However, dedicated brain neurosurgical centers may request 3.0 Tesla scans for improved resolution and detail in neurological imaging. It is essential to note that MRI technology requires continuous upgrades and investments. Software updates and specialized coil technology are costly but necessary to ensure optimal image quality. High-quality imaging centers prioritize these upgrades, while lesser facilities may lag behind in adopting the latest advancements. CT scans are ordered to visualize cortical bone pathologies, such as osteophytes, fractures through the cortical bone, and complex fractures. They are also routinely used for emergency brain scans due to their ability to detect blood efficiently. Additionally, Connecticut scans are utilized for coronary calcium studies and chest imaging, as they can capture motion more effectively than MRI. Emergency departments typically have CT technicians available around the clock, enabling prompt imaging in critical situations. Due to the speed of CT scans, the scanners are often readily available, unlike MRI technicians who may not be present 24/7 except at major institutions. CT scanners have a ring-like design, as opposed to the bore or tunnel configuration of MRI scanners. This broad, shallow design rarely induces claustrophobia in patients. When it comes to obtaining imaging reports, it is advisable to request them directly from the imaging facility rather than the ordering physician. Imaging centers are dedicated to producing high-quality images, generating reports, and securely transmitting them via fax or e-fax, which is HIPAA compliant. To obtain imaging reports, you will need to provide the patient's name, date of birth, type of imaging study, and the region imaged. Larger institutions may require you to fax an executed records release document before providing the reports. Contacting the ordering physician's office for imaging records is generally not recommended. Many offices are overbooked and understaffed, making it difficult for them to retrieve and transmit records promptly. By requesting records directly from the imaging facility, you can often obtain them before completing the patient's history. In addition to the reports, it is essential to review the actual images, either through a CD or by accessing the imaging center's PACS system. Remember to adhere to HIPAA regulations when accessing and handling patient images. Musculoskeletal ultrasound, MSK-US, offers unique advantages in the diagnostic process. One significant benefit is its ability to visualize pathologies that may no longer be evident on MRI due to the absence of blood or edema. Additionally, MSK-US allows for dynamic imaging, enabling the evaluation of structures under stress or motion, which can degrade MRI images. MSK-US technology continues to advance, providing greater detail and resolution. Fusion-US, which combines real-time MSK-US with MRI or CT data, is an emerging field that offers even more comprehensive diagnostic capabilities. MSK-US can also be instrumental in guiding injections, ensuring accurate placement of therapeutic agents such as platelet-rich plasma, PRP, or stem cells into specific targets, including tears in tendons, ligaments, muscles, or joints. DEXA scans, or bone density studies, play a crucial role in assessing osteoporosis and related conditions. But when should we order DEXA scans, and for which patients? Osteoporosis is an expected condition in the senior population, but it should not be considered normal. Late-stage osteoporosis can lead to serious complications, such as vertebral compression fractures or femoral neck fractures, necessitating prompt diagnosis and treatment. Interestingly, young athletes may also require DEXA scans. Overtraining can suppress the endocrine system, leading to decreased levels of testosterone, estrogen, and progesterone. This hormonal imbalance, known as low energy availability or relative energy deficiency in sport, can contribute to osteoporosis in this population. Clinical suspicion of osteoporosis in young athletes may arise if they experience multiple stress fractures over time or if a bone stress response is slow to heal. In such cases, ordering a DEXA scan and evaluating hormone levels through laboratory tests can provide valuable insights and guide appropriate interventions. I recommend not reviewing imaging or imaging reports until after completing the patient's history, physical examination, and formulating a working diagnosis. This approach helps reduce the potential for bias that may arise from premature exposure to the imaging findings. As healthcare professionals, we approach patient care from a functional perspective, considering the patient's overall well-being and functional abilities, regardless of the anatomic pathology present, within reasonable limits, of course. In contrast, surgeons often follow a different pathway. They prioritize reviewing imaging studies first to determine if the patient has an anatomic pathology that could potentially be addressed through surgical intervention. If the imaging reveals a surgical candidate, they may proceed with recommending an operation. However, if the findings do not indicate a surgical solution, they may refer the patient to pain management specialists, physical therapists, or chiropractors. While the recommendation to review imaging after the history and examination is generally advisable, there are exceptions where it is prudent to assess the imaging findings earlier. In cases of trauma, where the possibility of fractures or dislocations exists, reviewing imaging up front can provide crucial information for appropriate triage and management. Another exception is in the context of cancer. When dealing with suspected or known malignancies, it is essential to review available imaging, reports, and laboratory tests prior to the patient encounter. This proactive approach helps identify potential pathological fractures or metastatic sites that could be contributing to the patient's presenting symptoms, allowing for more informed decision-making and efficient care coordination. In conclusion, the judicious application of common sense on a case-by-case basis is paramount when determining the optimal sequence of diagnostic steps. While adhering to general guidelines is advisable, we must remain flexible and adapt our approach to the unique circumstances of each patient. By leveraging the wealth of diagnostic tools at our disposal, including advanced imaging modalities, we can enhance our ability to arrive at accurate diagnoses and develop comprehensive treatment plans tailored to individual patient needs. Thank you for your attention, and I look forward to further discussions on this vital topic.